Hello, doctor. Here we are at the absolutely gorgeous Emirates Palace Hotel in Abu Dhabi, and I was thinking today about talking to you about your child patients. First of all, think about something. Are you aware that over 50%, maybe as high as 75% of them, have airway issues that have not been diagnosed, neither in the pediatrician setting or in the dental setting? And while sleep apnea has become a very popular topic right now, the reality is that these kids are getting missed. They're not getting the treatments that they need, and you can be part of life transformational treatments for them and awarenesses for them that they really need. So I was thinking about that, and even bedwetting, think about it, even hyperactivity. There are things that are related to airway issues that might surprise you, and we can talk about and do talk about how to help these children. So that's the first thing I was thinking about. The second thing I was thinking about is how expansion can work with and in the setting of airway issues, and how you actually have treatments that can help the child patient to do better, to have some amazing results of your expansion. And this is important because while you can see, notice, and refer, and we can talk about that too, the reality is that your treatments can actually help them a lot as well. So that's one thing. And then on top of that, think about the fact that the great majority, almost every child you see today, has incisors that erupt into crowded and rotated positions. Almost every child. Why is that? What's going on? And what can you do about that? And I'm going to give you a little bit of an idea, and that is clear the path of eruption. But when? And how? And how do you decide when? And how do you decide what's going to happen after that? Because something else is going to come next, which is using the space first for the incisors, allowing them to erupt, and then what happens next? Good questions, right? Then I wrote down, learn what you can do and how to identify the problems that the child is having even as young as an infant. I'm sure you've heard about the nursing problems that infants are having with ankyloglossia, tongue tie. When do you do a frenectomy? What do you do about them? Sublingual, maxillary midline? What do you do with the child, the baby, with nursing problems? How do you go about it? What is the procedure, and how do you proceed? And that's another thing we can talk about in our seminars to come. Then we also will be talking about habits, because habits are interwoven with all of this. They're interwoven with tongue position, with frenum problems. They're interwoven with airway problems, and habits, be it literally a baby bottle, a pacifier, a sippy cup, a thumb, fingers, blanket, whatever the habits, they all have some commonality that actually creates adverse growth of the jaws, of the maxilla and the mandible. And you can do plenty about that as well from a pretty young age. And that's something else you need to know: when, how, and what. Those are some other things to talk about. And then finally, what else do we want to talk about? Let me just think for a second. The transformations that you can provide with the airway issues, and this is sleep apnea, by the way, for children, but reality is that it goes across such a wide range of symptoms and signs that it doesn't necessarily get talked about as well as it should. So you'll learn about that. You'll learn about expansion. You'll learn about habits. You'll learn about frena. You'll learn about all of clearing the path. You'll learn about all of these issues. Where? When? Well, come to our Interception Orthodontics weekend. That's iOrtho, as we call it, iOrtho. And learn about this. Learn what to do, and learn which parts of these treatments you might want to incorporate into your treatment of your child patients. They are truly transformational. And you can come, join us, and when you do, you will enjoy your colleagues, friendship, food, fun. We look greatly forward to seeing you there and sharing these things with you. Dr. Chris, signing off.